Did you know that daily masturbation could have surprising effects on the prostate? Whether it's beneficial or harmful, the answer might surprise you. Welcome to Vibrant Seniors, where we believe in exploring topics that matter to your health and well-being, no matter your age. Today, we're diving into a subject that's often surrounded by myths, misconceptions, and a whole lot of curiosity: how frequent masturbation impacts the prostate gland. In this video, we'll explore the science behind this topic, including potential benefits, risks, and myths. We'll look at what research says, share expert insights, and help you understand how this common activity might be affecting your prostate health. Whether you're here out of curiosity or because you've noticed changes in your body, this video is for you. Now you might be wondering, why does this even matter? Well, the prostate is a small but mighty gland that plays a crucial role in men's health. It's involved in both urinary and sexual function, and issues with the prostate can have a big impact on your quality of life. From prostate cancer to benign prostatic hyperplasia, BPH, understanding how to keep this gland healthy is essential, and that's where masturbation comes into the picture. Some studies suggest that frequent ejaculation might have benefits for the prostate, while others raise questions about potential risks. So, what's the truth? Let's dive in and find out. But before we get started, I want to remind you that this is a judgment-free zone. Whether you're here to learn, to feel more informed, or just to satisfy your curiosity, you're in the right place. My goal is to empower you with the knowledge you need to make the best decisions for your health. So grab a cup of tea, get comfortable, and let's explore this fascinating topic together. Before we dive into how masturbation affects the prostate, let's take a moment to understand what the prostate actually is and why it's so important. The prostate is a small, walnut-sized gland that's part of the male reproductive system. It's located just below the bladder and surrounds the urethra, which is the tube that carries urine and semen out of the body. Despite its small size, the prostate plays a big role in both urinary and sexual health. One of the prostate's main jobs is to produce seminal fluid, which is a key component of semen. This fluid helps nourish and transport sperm, making it essential for fertility. Without a healthy prostate, sperm wouldn't have the support they need to survive and function properly. The prostate also plays a role in regulating urine flow. Because it surrounds the urethra, any changes in the prostate, like swelling or inflammation, can affect how easily you can urinate. This is why prostate health is so closely tied to both sexual and urinary function. Now let's talk about some common prostate issues that men may face as they age. One of the most common conditions is prostatitis, which is inflammation or infection of the prostate. This can cause symptoms like pain during urination, pelvic discomfort, and even flu-like symptoms. While prostatitis can be uncomfortable, it's usually treatable with antibiotics or other medications. Another common issue is benign prostatic hyperplasia, or BPH. This is a non-cancerous enlargement of the prostate that often occurs as men get older. As the prostate grows, it can squeeze the urethra and make it harder to urinate. Symptoms of BPH include a weak urine stream, frequent urination, and feeling like you can't completely empty your bladder. While BPH isn't life-threatening, it can definitely affect your quality of life, and there are treatments available to help manage the symptoms. And then, there's prostate cancer, which is one of the most common cancers in men. Prostate cancer occurs when cells in the prostate gland grow out of control. In its early stages, prostate cancer often doesn't cause any symptoms, which is why regular screenings are so important, especially for men over 50 or those with a family history of the disease. If caught early, prostate cancer is highly treatable, but if left untreated, it can spread to other parts of the body and become more serious. So, as you can see, the prostate is a small but mighty gland with a big impact on men's health. Understanding how it works and what can go wrong is the first step toward taking better care of it. And that brings us back to our main topic: how daily masturbation might affect the prostate. Is it helpful, harmful, or somewhere in between? Let's explore the science and find out. Now that we've covered the basics of the prostate, let's dive into the science of how masturbation and frequent ejaculation in general might affect prostate health. This is a topic that's sparked a lot of debate, and there's plenty of research out there to help us separate fact from fiction. So, let's start by looking at how frequent ejaculation, whether through masturbation or sex, impacts the prostate. First, let's talk about the potential benefits. One of the most talked about studies in this area comes from Harvard University, which found that men who ejaculated more frequently, about 21 times a month, had a lower risk of developing prostate cancer compared to those who ejaculated less often. The theory behind this is that frequent ejaculation helps flush out toxins and potentially harmful substances from the prostate, reducing the risk of inflammation or cell damage that could lead to cancer. Another study published in the British Journal of Urology International supported these findings, suggesting that regular ejaculation might help maintain a healthy prostate by promoting better blood flow and reducing congestion in the gland. But what about the risks? While frequent ejaculation might have some benefits, it's not without potential downsides. For example, overstimulation or excessive masturbation could lead to pelvic floor strain, especially if you're not giving your body enough time to recover. This can cause discomfort or even pain in the pelvic area, and in some cases, it might contribute to issues like prostatitis or chronic pelvic pain syndrome. It's also worth noting that compulsive masturbation, where it becomes an uncontrollable habit, can have psychological effects, such as feelings of guilt, anxiety, or even depression. If you find that masturbation is interfering with your daily life or relationships, it might be worth talking to a therapist or counselor to address any underlying issues. Now let's clear up some common myths. One of the biggest misconceptions is that masturbation causes prostate cancer. This is simply not true. In fact, as we've seen, some studies suggest the opposite, that regular ejaculation might actually reduce the risk. Another myth is that masturbation lowers testosterone levels. While it's true that testosterone levels can fluctuate throughout the day, there's no evidence to suggest that masturbation has a long-term impact on your hormonal balance. In fact, some research suggests that sexual activity, including masturbation, might temporarily boost testosterone levels, which could have positive effects on mood, energy, and overall well-being. So, what's the takeaway here? The science suggests that frequent ejaculation, whether through masturbation or sex, can have both benefits and risks for prostate health. The key is moderation and listening to your body. If you're experiencing any discomfort or unusual symptoms, it's always a good idea to talk to a healthcare professional. And remember, everyone's body is different, so what works for one person might not work for another. The important thing is to stay informed and make choices that support your overall health and well-being. Now, let's talk about some of the strange changes that can occur in the prostate due to frequent masturbation. As we've already touched on, the effects aren't always straightforward. They can be positive, negative, or even a mix of both, depending on the individual. So, let's break it down and explore what these changes might look like. First, let's start with the positive changes. One of the most notable benefits of frequent ejaculation is improved blood flow to the prostate. Just like any other part of the body, the prostate needs a good supply of oxygen and nutrients to stay healthy. Regular ejaculation can help stimulate blood circulation in the pelvic area, which may reduce the risk of congestion or stagnation in the prostate gland. This improved blood flow can also help flush out toxins and waste products that might otherwise build up and cause inflammation. In fact, some experts believe that this flushing out effect is one of the reasons why frequent ejaculation has been linked to a lower risk of prostate cancer in some studies. Another potential benefit is the reduction of inflammation. The prostate is prone to inflammation, especially as men get older, and this can lead to conditions like prostatitis or benign prostatic hyperplasia, BPH. By promoting regular ejaculation, you might be helping to keep the prostate cleaned out and less likely to become inflamed. Think of it like giving your prostate a little workout. It stays active, healthy, and less prone to problems. But what about the negative changes? While there are potential benefits, it's important to acknowledge that frequent masturbation isn't without its risks. For some men, overuse can lead to pelvic discomfort or even fatigue. If you're masturbating excessively, you might notice soreness in the pelvic area or a feeling of strain in the muscles surrounding the prostate. This is especially true if you're not giving your body enough time to recover between sessions. In some cases, this overuse can contribute to conditions like chronic pelvic pain syndrome, which can be difficult to manage and may require medical intervention. There's also the psychological side of things to consider. For some men, frequent masturbation can lead to feelings of guilt, anxiety, or even shame, especially if it becomes compulsive or starts to interfere with daily life. If you find yourself masturbating not because you want to, but because you feel like you have to, it might be a sign that there's an underlying issue that needs to be addressed. Compulsive behavior can sometimes be a way of coping with stress, boredom, or other emotional challenges, and it's worth exploring these feelings with a therapist or counselor if they're causing you distress. Now, here's the thing. The effects of frequent masturbation on the prostate can vary widely from person to person. Factors like age, overall health, and lifestyle all play a role in how your body responds. For example, a younger man with no underlying health issues might not notice any negative effects from frequent masturbation, while an older man with an enlarged prostate or other health concerns might experience more discomfort. It's also worth noting that everyone's body is different, so what works for one person might not work for another. The key is to pay attention to your body and how it feels. If something doesn't feel right, it's always a good idea to talk to a healthcare professional. So, what's the bottom line? Frequent masturbation can lead to some strange changes in the prostate, some positive, some negative, and some that depend entirely on the individual. The important thing is to stay informed, listen to your body, and make choices that support your overall health and well-being. And if you're ever unsure, don't hesitate to seek professional advice. Your prostate and your peace of mind are worth it. Now that we've explored the potential effects of frequent masturbation on the prostate, let's talk about how to strike a healthy balance. The key here is moderation, listening to your body, and making choices that support your overall health. Masturbation is a natural and normal part of life, but like anything else, it's all about finding the right balance. So, let's dive into some practical tips for maintaining prostate health while enjoying a healthy sex life. First and foremost, moderation is key. While frequent ejaculation might have some benefits for the prostate, overdoing it can lead to discomfort or other issues. The trick is to pay attention to how your body feels. If you notice any signs of strain, soreness, or fatigue, it might be a sign that you need to slow down and give your body a break. On the other hand, if you're feeling good and not experiencing any negative effects, there's no need to worry. Everyone's body is different, so what works for one person might not work for another. The important thing is to stay in tune with your body and make adjustments as needed. But masturbation isn't the only factor when it comes to prostate health. There are plenty of other habits you can adopt to keep your prostate in tip-top shape. Let's start with diet. What you eat plays a huge role in your overall health, and that includes your prostate. Foods rich in antioxidants like tomatoes, green tea, and nuts are especially beneficial. Tomatoes, for example, are packed with lycopene, a powerful antioxidant that has been linked to a reduced risk of prostate cancer. Green tea is another great option. It's loaded with catechins, which have anti-inflammatory and cancer-fighting properties. And don't forget about nuts. Walnuts, almonds, and Brazil nuts are all rich in healthy fats, vitamins, and minerals that support prostate health. The key is to focus on a balanced diet that includes plenty of fruits, vegetables, whole grains, and lean proteins. Exercise is another important piece of the puzzle. Regular physical activity can help improve blood flow, reduce inflammation, and support overall prostate health. But it's not just about cardio or weightlifting. There are specific exercises that can target the pelvic area and strengthen the muscles that support the prostate. Kegel exercises, for example, are a great way to strengthen the pelvic floor muscles, which can help improve bladder control and reduce the risk of prostate issues. To do Kegels, simply tighten the muscles you would use to stop the flow of urine, hold for a few seconds, and then release. Aim for 10 to 15 repetitions a few times a day. Over time, you'll notice improved muscle tone and better control. And let's not forget about regular checkups. As men get older, the risk of prostate issues increases, so it's important to stay on top of your health. If you're over 50, or if you're at higher risk due to family history or other factors, it's a good idea to schedule regular prostate screenings. These screenings typically involve a blood test called a PSA, prostate-specific antigen, test, and a digital rectal exam, DRE, to check for any abnormalities. Catching potential issues early can make a huge difference in terms of treatment and outcomes, so don't skip those appointments. So, what's the takeaway here? Balancing masturbation and prostate health is all about moderation, healthy habits, and staying proactive about your health. By eating a balanced diet, staying active, and keeping up with regular checkups, you can support your prostate and enjoy a healthy, fulfilling sex life. And remember, if you ever have any concerns or questions, don't hesitate to talk to a healthcare professional. Your prostate and your overall well-being are worth it. Now, let's talk about when it might be time to seek professional help. While lifestyle changes and healthy habits can go a long way in supporting prostate health, there are times when you might need to consult a doctor. Recognizing the warning signs and acting on them early can make a huge difference in terms of treatment and outcomes. So, let's go over some of the key symptoms to watch out for, and when it's time to pick up the phone and call a urologist. First, let's talk about pain. If you're experiencing pain during ejaculation or urination, it's definitely a red flag. Pain during ejaculation could be a sign of prostatitis, which is inflammation or infection of the prostate gland. It could also indicate other issues, like a blockage or an injury to the pelvic area. Pain during urination, on the other hand, might be a sign of a urinary tract infection, UTI, or even something more serious, like an enlarged prostate or prostate cancer. Either way, pain is your body's way of telling you that something isn't right, and it's important to listen to that message. Another warning sign to watch out for is blood in your semen or urine. This can be alarming, and for good reason. It's not something you should ignore. Blood in the semen, also known as hematospermia, can be caused by a number of things, including infections, inflammation, or even trauma to the pelvic area. While it's not always a sign of something serious, it's definitely worth getting checked out. The same goes for blood in the urine, which could be a sign of a urinary tract infection, kidney stones, or even prostate cancer. If you notice blood in your semen or urine, don't panic, but do make an appointment with your doctor as soon as possible. Persistent discomfort in the pelvic area is another symptom that shouldn't be ignored. This could feel like a dull ache, pressure, or even sharp pain in the lower abdomen, groin, or lower back. While occasional discomfort might not be a big deal, if it's persistent or getting worse over time, it could be a sign of an underlying issue. For example, chronic pelvic pain syndrome, CPPS, is a condition that causes ongoing pain in the pelvic area and is often linked to prostate issues. Other potential causes include an enlarged prostate, prostatitis, or even prostate cancer. The bottom line, if you're dealing with persistent discomfort, it's time to see a doctor. So, what should you do if you're experiencing any of these symptoms? The first step is to consult a urologist, a doctor who specializes in the urinary tract and male reproductive system. A urologist can perform a thorough evaluation, which might include a physical exam, blood tests, imaging studies, or even a biopsy if necessary. They'll be able to pinpoint the cause of your symptoms and recommend the best course of treatment. And remember, there's no need to feel embarrassed or ashamed. Urologists deal with these issues every day, and their goal is to help you feel better. If you're hesitant to see a doctor, I want to encourage you to take that step anyway. Early detection is key when it comes to prostate health, and many conditions are much easier to treat when they're caught early. Plus, getting answers can bring a lot of peace of mind, whether it's a minor issue that can be easily treated or something more serious that requires ongoing care. The important thing is to take action. Your health is worth it. So, if you've been experiencing any of these warning signs, pain during ejaculation or urination, blood in your semen or urine, or persistent pelvic discomfort, don't wait. Make an appointment with a urologist and get the answers you need. Taking care of your prostate is an important part of taking care of yourself, and you deserve to feel your best. All right, let's wrap this up. We've covered a lot of ground today, and I hope you're walking away with a better understanding of how daily masturbation can affect your prostate health. To recap, daily masturbation can have both positive and negative effects on the prostate, depending on factors like frequency, your overall health, and your lifestyle. On the positive side, regular ejaculation may help improve blood flow, flush out toxins, and even reduce the risk of prostate cancer. But on the flip side, overdoing it can lead to pelvic discomfort, fatigue, or even psychological stress if it becomes compulsive. The key takeaway: moderation and awareness are key. Listen to your body, make informed choices, and don't hesitate to seek professional help if something doesn't feel right. Taking charge of your prostate health is about more than just masturbation. It's about adopting a holistic approach to your well-being. That means eating a balanced diet rich in antioxidants, staying active with exercises that strengthen your pelvic floor, and keeping up with regular checkups, especially as you get older. Your prostate plays a vital role in your overall health, and taking care of it is an important part of taking care of yourself. Remember, it's never too late to make positive changes, and every small step you take can make a big difference in the long run. If you found this video helpful, I'd love for you to give it a thumbs up and share it with someone who might benefit. Maybe it's a friend, a family member, or a partner who could use a little encouragement. Let's spread the message that prostate health is something every man should be talking about. And if you're not already subscribed, hit that button and join the Vibrant Seniors community. We're all about living life to the fullest, no matter our age, and I'd love for you to be part of that journey. Before I go, I want to leave you with this thought. Your health is in your hands. Whether it's making small changes to your diet, incorporating Kegel exercises into your routine, or scheduling that long overdue checkup, the power to take control of your prostate health is yours. So, take that first step today, and let's thrive together. Thanks for watching, and I'll see you in the next video.